At the same time, we are developing a proposal for redevelopment of the Mile, which is a significant investment proposal, which would also include potential for investment in primary care within the central Wrexham area. That is an early stage in development, including quite intensive work in terms of engagement of the people who are involved who will be working in the project, but the first stage is in developing broad costing and the concept of what effectively a new hospital on the Mile would look like, and that's in the early stage of development. And I'm hopeful that as it went further down that decision-making process, that would sweep up some of the issues that we've got around primary care in the central Wrexham area, because the plan will include a primary and community services hub as part of the Mile redevelopment. But as you can imagine, it's early days in the process for that. It's positive that it's been supported within the health board, but there's some way to go before that's approved at a national level, given the level of obviously investment involved that we'll be asking for. The business case will include a requirement for staffing, but I haven't got the numbers for that in terms of additional. It will be focused mainly on the capital investment rather than an increase in the staff that we've got working in the unit, because the pressures that we've got around staffing, as I think we talked about a bit before in previous meetings, are around the ability to recruit, which don't tend to lend themselves to an investment proposal. It's more about us being able to be more successful in attracting nurses to work in the area. But obviously, a new investment proposal and a new gleaming new hospital can only help in that regard. So we would hope that would make that situation more positive. In terms of the number for the involved in the investments, it's a big. Now I haven't got a figure at my fingertips in terms of the Mile, but it's hundreds of millions. I mean, it's a substantial investment. Apologies, I haven't got the number at my fingertips, but I'm happy to come back and clarify what that number is. It's in the hundreds of millions. It will certainly start to see improvement within the next 5 years. The timeline obviously largely depends on when that clock starts ticking from and when we get approvals, but certainly if we start to see progress within the near future, you start to see progress within the next 5 years.
Gwen John.
You're talking about primary care, and that will be based in the Mile, will it? Like a super surgery in the Mile? Is that what you're thinking of as part of the new development?
Yes.
Yeah, okay.
It's just yeah.
Right.
It would be part of the existing site. I mean, it's obviously quite a big site on the Mile, so there's quite a lot of flexibility to be able to use that. It does cause some challenges in terms of transport into the site, and we haven't worked through how they'll be resolved yet, but we recognise that as being a significant challenge and make sure it needs to be resolved. But obviously we're working closely with the council, and we would be increasingly to be able to do that. So there's nothing to take there aren't many assumptions in there at the moment in terms of the plan, and that kind of illustrates where we are in the planning process. So I do need to emphasise in terms of how this could be reported, very, very early days with this as a proposal. So any questions that arose out of the conversation would really just need to feed back into the planning process for the development. The GPs in Wrexham are independent practitioners, have their own premises, who may wish to decide where they are in those premises, and that's something that will be up to discussion. We would want to engage with them and encourage them to move into a new building within the Mile, because our approach strategically with Welsh Government is if we're having one investment, we feel that it's more a viable proposition if that investment includes the requirements for primary care as well, rather than having to go back to Welsh Government and say, shortly after we've asked you for a significant investment for the hospital, we also need this as well for primary care. Our approach has been to say actually the requirements for health in Wrexham need to be covered with this investment in one size proposal. So that's how we're approaching that. But we are developing that in a way that fits with how we're developing the localities in Wrexham. So it will be referred to in our close to home strategy. So we are linking the two things together.